Indianapolis doctor Caitlin Bernard is appearing before the state medical licensing board after a complaint by Attorney General Todd Rokita.
Bernard is the doctor who performed an abortion on a 10-year-old rape victim from Ohio. Fox 59 State House reporter Kristen Eskow is following along with that hearing today.
Yeah, Kristen joins us live with an update on the proceedings. Kristen, what can you tell us?
Yeah. Well, Dan and Aaliyah, this hearing is still going on. It's been going on for almost 9 hours now. It started around 9:30 this morning, and it's expected to continue for a few more hours. Now, Indiana Attorney General Todd Rokita alleges that Dr. Bernard broke the law. He alleges that she violated patient privacy laws by sharing that story with the Indianapolis Star, and he alleges that she failed to report the abuse of that child. Those are allegations she and her legal team deny. Tonight, the medical licensing board is expected to make a decision on whether Bernard should be disciplined.
The whole truth and nothing but the truth, so help. Thank you.
Dr. Caitlin Bernard says she didn't do anything wrong when she told the Indianapolis Star last summer she performed an abortion on a 10-year-old rape survivor from Ohio.
I did not release any protected health information. I complied with all patient confidentiality and HIPAA laws to the best of my knowledge.
Shortly after the story was published, Indiana Attorney General Todd Rokita went on Fox News alleging misconduct by the doctor.
We have this abortion activist acting as a doctor with a history of failing to report.
After consumer complaints were submitted, which Bernard's legal team called bogus, Rokita filed a complaint with the medical licensing board. He and his team argue Bernard violated the patient's privacy rights and didn't notify the state of the abuse as required.
She failed to report the abuse to Indiana law enforcement and to Indiana DCS.
Last summer, we obtained the paperwork showing Bernard reported the abortion to the state July 2nd, 2 days after she saw the child. State law requires such reporting within 3 days. During questioning by the AG's legal team on Thursday, Bernard said the terminated pregnancy report informed the Indiana Department of Child Services of the abuse. She acknowledged she didn't speak with law enforcement directly, but followed her hospital's protocol, which requires her to inform an IU Health social worker.
I followed IU Health policy, which is to report any known or suspected child abuse to the designee, which is the IU Health social worker, and then the reporting is made from there.
The social worker testified she reported the rape in Ohio, the state where it occurred. When questioned by the AG's legal team, Bernard says she shared the child's story with the Indianapolis Star to demonstrate how abortion restrictions affect patients.
Why didn't you use a hypothetical instead of your patient's information?
I think that it's incredibly important for people to understand the real world impacts of the laws of this country.
Now, the hearing is still going on, and it's likely to take perhaps a few more hours as the medical licensing board is expected to make some kind of decision this evening. For now, we're live here in downtown Indy. Kristen Eskow, Fox 59 News.
Kristen, thanks.